Today we're talking about common misconceptions in IVF. This is Dr. Deepa from Sree Nandaka Fertility and Laparoscopy Center. So the first misconception is that IVF is required for everybody. Actually, there's some indications for IVF, like anybody having bilateral tubal block or bilateral self-injectable done for ectopic pregnancies or severe endometriosis or severe male factor infertility. For them, on the first visit itself, we tell them that the IVF would be a better option for them. But for remaining other people, we always go like we can have lesser invasive treatments like ovulation induction or going for diagnostic hysterolaparoscopy or IUIs would be better. So we have to individualize treatment according to the patient's conditions. The second misconception regarding IVF is people ask for guarantee. It's not possible. Like, we have to talk in terms of success rate and limitations rather than talking about the guarantee of baby in IVF. The success rate varies from 30% to 60% depending upon the age of the couple and the underlying causes. And third misconception is like IVF is only for older women. It is not like that. Of course, older women more than 35 years or 38 years, the more probability of them going towards IVF is more. It doesn't mean that the younger one doesn't require IVF. If this younger age group woman is having like severe endometriosis or bilateral tubal block, the IVF would be the first choice for them. And next misconception is about like IVF is painful and risky. IVF is not, I won't say it's painless totally. Only the injection part, of course, is painful. This risky part, in fact, nowadays the IVF is much safer, I would feel, because in previous days, because of the protocols, because there are different type of injections, there was because of lack of freezing techniques, the hyperstimulation risk was more in IVF. But nowadays, because of the newer techniques, newer injections, newer protocols, and high-end freezing techniques, which we call as vitrification, the risk for hyperstimulation has come down. So I would feel, and it's done only in 15 days, like IVF picking up the eggs and making the embryos. This is done in 15 days. I think that is much safer option and good option. And next comes cost of IVF. They say the cost of IVF is same for everybody. No, it's not that. Never like that. Always IVF should be treated according to the patient needs, like individualize the treatment. So some patient may require more drugs, some patient may require lesser drugs. So depending on that, the cost will be changing. There is no fixed treatment for everybody. We have to individualize always. And one more misconception is that they say that IVF always results in multiple pregnancies. It's not like that. Nowadays we have a law, and according to that we have to either go for one embryo transfer or two embryo transfer. So if you ask me which is a better one, always I prefer one single embryo transfer. Carrying a single baby is always anytime much easier, convenient for the mother. Some people ask that IVF increases the risk of multiple birth defects. In general population also, the birth defects are around 3.5 to 4%. In IVF, the risk has been a bit higher, like around 1% more than the natural population. So that is only minimal in fact. Yeah, some people ask me that if I go through this IVF, do I need to go for a complete bed rest, something like that? That's not required. The rest is not physical, it is mental rest. Just relax and enjoy this motherhood. There's nothing like that. Yeah, myths can be misleading, and knowing the fact is empowering. If you have any questions or topics you would like us to cover in the future, please leave a comment down below.